There won't be a password set in here, which is not what's going on right now. We will get that one. What is that doing? Oh, it's charging. Hang on. Your system should be. Okay. I want to make sure your system's not about to honk out on me. Okay, I think it's good. I don't know why it's shutting down. Sorry, that's y'all's system. This is just the demo one. Okay, so once a day, shut it down. It has to be reset at least once a day. You don't want to leave it on all the time because it'll start doing wonky things if you do. So you can turn it right back on if you need to, but just make sure it powers down. And then when the screen goes black, you can shut it if you want to. Just let it go black first so it doesn't get too hot. This cart goes up and down with this little handle over here. So if you need to scan lower to the ground, you could tilt the screen if you needed to, or adjust the height if you need to be taller. As far as cleaning the probes, you can use like baby wipes, just something soft, and you can dampen it if you need to. Inside, well, actually, I don't know if you guys got probe boxes. Did you get the boxes that the probes came in by any chance? Probably not, since it's a demo. Did you get a box that holds the probes?
Oh, no.
Okay. It has a big list of cleaning supplies you can sterilize the probes with if you needed to. Most people don't do that, but like Lysol wipes, Clorox wipes, those things are okay. There are some that aren't, but that's probably the most readily handy things that you might use.
Rescue wipes?
Yeah.
Rescue wipes?
Which ones are rescue wipes?
It's going to be the one on
Oh,
the
it's.
bottom.
I am not sure about that. I can try to find the list for you guys and email it to you. I know there's only a couple that aren't acceptable. I don't think that's one of them.
I was thinking
like
Clorox wipes
transeptic-
are fine, then I would think this is fine.
Transeptic spray is not. There's only a few, but I'll see if I can get a list sent to you since y'all don't have that actual hard copy. But what it'll do is it'll yellow the rubber and yellow the cable if it's not acceptable. But I'll try to get that to you.
And it just discolors it? It doesn't,
Yeah,
like,
I don't
affect
think
it?
I've done it on the human side. I came from the human side, and we used, during COVID, we used whatever we had on hand, and it turned it yellow. It just, I don't know if that's what all of the ones that aren't acceptable do, but you just need to be careful when you rub. You don't want to rub too hard because this rubber can tear too. But I think it will just yellow your cable, but I'll find out for sure because I don't want you guys to do that. That's about it as far as maintenance. Do you guys have any questions? Pretty simple. Okay. All right, so to start your study, when you guys are ready to scan, you're going to go to the patient button. Can you guys see these buttons, or should I lower it? Is that a little too high for y'all? You're going to start your study with patient. What you put in on this screen is entirely up to you, but what you want to do is just have a unique animal ID. You don't want to use like the client ID because they might have multiple pets, because it's always going to remember that number and you won't be able to duplicate it once you've used it once. So put in a unique number. Most people use like the x-ray number. And then last name and first name. You don't have to do anything else on here. You don't need to choose what category you're doing. You can if you want. You can go to the details tab over here on the left if you want to type in more information. And your set key on here is like your enter key if you didn't know that. Just move your trackball with the cursor, and if you don't see a cursor, there's a cursor button and you can push it to pull up a cursor. So details tab gives you a whole lot more space to type things in, but otherwise you can stay out of that one. So once you have, let me just type in, we'll do today's date. And we'll make up a patient here. So after you type in your number and your name, the next thing you're going to do, you can either go down to the scan tab at the bottom, or you can just hit freeze. It'll take you into the screen as well. And then the next thing you want to do is go to probe. Probe is the next button down below patient. On this system, you only have the option to have one probe plugged in at once. So that is the one that should register. If for some reason you don't see a probe up here, it's not completely in there. Are you guys familiar with how to plug these in and out, the probes? Okay. Just make sure you go in straight with it and then flip the switch. If it doesn't register, then it's not in there correctly. So you see your 8C or your 12L under.
Does it have to be like the mind ray? We have to freeze it and then switch it out? Does it have to be that?
I don't think you necessarily have to, but it's probably better for the system if it is.
Okay.
Before you move on to the next one, just make sure it's frozen. Sometimes it'll freeze over time, so a lot of times it's frozen anyway. But yeah, you would want to freeze it first. All right, so under the 8C, you're going to have a row of abdominal presets and then a row of cardiac presets. This one has something called EW. I don't know what that is. This is his demo system. But you should have a feline abdomen, small, medium, and large abdomen, and then...
Kind of angle it.
Oh, yeah, can you see?
Yeah,
Is
there
that
we
better?
go. Yes,
You all
much.
see that? And then you should have feline heart, and then... Actually, on here, there's a couple of different things. You should, on your system, when I install presets, it'll say small, I think it'll say feline, small, medium, large heart. Basically, all those is a starting point for the size of the animal that you're going to be scanning. If you were going to scan a Chihuahua and you chose large abdomen, it's not the end of the world. It's just your depth is going to be really deep and your frequency is going to be really low. So it just gives you a good point to start out. So once you choose your preset, it'll default to medium abdomen as well if you don't choose anything. And then I believe on your 12L, it's going to default to 12L abdomen, which should be pretty good for most things that you'll use it for. So once you choose your preset, it's going to take you into your scanning screen. And then the first thing you always want to do is optimize your picture. Because even though you chose that preset, that doesn't mean your image is beautiful and you don't have to do anything else. The first thing you want to optimize with is your depth. And the depth knob is labeled zoom on the knob, but it's labeled depth here on the console. It's going to be in centimeters along the right side of your screen. In general, whatever you're going to be scanning, you want it to take up about 2/3, bless you, 2/3 of your image. So for instance, if you had the kidney up here, you want it to take up most of your picture because it keeps your frame rate high and your resolution the best. You wouldn't want your kidney to be teeny tiny up here and then have like 12 inches below it because that's not what you're trying to look at. And then your frame rate goes down and you can't see the detail of that kidney very well. So a good guide is just to have about 2 or 3 fingers width below the area that you're wanting to see. So if you have the liver on the screen, you want to make sure you have the entire liver with the diaphragm at the bottom and then maybe a couple of fingers. But you don't want to cut edges of organs off because you might be missing something that's there. Okay, so depth is the knob here and you turn it left to go shallow, right to go deeper. And again, it's in centimeters. So after you've adjusted your depth for what you're looking at, the next thing you want to do is your focal position. All of these arrow keys here, 1 through 5, they control functions at the bottom of your monitor. And those choices will change depending on what mode you're in. So right now, the number 5 arrow key is going to be focal position. What the focal position is the narrowest part of your ultrasound beam. So as your beam comes in, where the focal point is, it's going to get very narrow and then it diverges back out. That's going to be where the best resolution on your image is. So it's kind of like when you focus a camera before you take a picture. Same situation, and it corresponds with this little cursor here that kind of looks like a little pi sign, and you move it up and down with this arrow, or these arrow keys. So if you did have the kidney here, you want to put that focal position right at or just below the kidney. If you had it too high, then part of that kidney is going to be a little blurry. You're not going to get that great of detail. If you had the liver on the screen taking up most of your picture, you want to bump that focal position way down to the bottom. You can have more than one focal point with the number 4 arrow keys, and it corresponds here. It says focal number. If you go up, it's going to add focal points. Now, when you do that, it's going to slow down your frame rate tremendously. And your frame rate's listed up here with all of your other settings, so it's at the top here and it says 18. If you go back down with just one focal position, it goes up to 53. So it makes a huge difference in your frame rate, and what will happen is when you're scanning, your image will move really slowly and you'll feel like you're swimming on the screen. So not great for resolution, but well, actually it's you get more detail, but the image is acquired so slowly that you'll think the picture looks terrible. The only time you might want to do that is if you had like multiple nodules in the liver and you needed to focus in on more than one spot, then you can add a focal point there. But I wouldn't go over 2 to keep your frame rate high. So that is focal position, and that option will change. For instance, if you're in color flow, this option becomes scale. So just keep that in mind. If your menu is not what you think it should be, think about what mode you're in. But also, this last set of arrow keys over here that aren't numbered, those are pages. If you scroll through these accidentally, if you hit those instead of what you're trying to hit, you will be on a different page, and there's 3 of them. So if you don't see your option, look up here and make sure you're on page 1, because there's your focal position. Okay, the next thing, probably the most important, is your frequency. It's going to be the number 1 arrow keys, corresponds right up here. This probe will go from a 6 to a 10 megahertz, and your goal is to scan with the highest frequency at all times to give you the best resolution. But to get deeper, to penetrate deeper within the body, for those deeper organs, you have to drop the frequency down. So if you're scanning, medium abdomen will default to an 8 frequency. If you have a really large dog, you're going to probably bump it down to a 6. Okay? But if you're scanning something really superficial, or a teeny tiny dog or a cat, you want to keep it as high as you can, because that's, your image is going to be prettier. So it's kind of inversely related. The deeper you go, the worse your image is, but the more clarity you get in that far field. Do you guys have any questions on frequency? Because that's one of the things that confuses people the most. Okay, the last thing of the main 4 ways to optimize is going to be your overall gain. And it's this knob here on the left that's labeled active, and it says gain on the console. What that does, if you turn it up and brighten up your image, it's going to amplify all of the returning echoes coming back to your probe over the whole screen. You also have your TGC sliders here that stand for time gain compensation. These knobs do the exact same thing as the gain knob, but at different depths. So if you ever accidentally hit these and you get them all out of order here, it's hard to tell, but you'll get stripes in your image. Turn the gain up so you can see this. There we go. Can you see that? It's hard to tell. You'll get stripes of brightness and darkness in your image if they're all out of whack like this, so you don't ever want to do that. Honestly, you can keep them up and down in the middle and not really mess with them much, unless you just need to tweak the image a little bit in the near field, or maybe a little bit in the far field. But if you're having to really slide these all over the place as you're scanning, something's not right with your image. Maybe the settings aren't right, or the machine's not right. But this just gives you a little bit of an extra way to tweak your image at different depths. Now, you don't want to, the reason we say use this last is because a lot of mistakes people make when they first start scanning is if their image is too dark, they think they just need to crank up the gain. But chances are you need to drop your frequency, because doing that will brighten up your entire image, because you're able to penetrate deeper. So try the frequency, or make sure your frequency is set right before you go messing with the gain. And the main reason for that is because you might make the spleen or the liver look abnormally bright, or the intestines or something, when there's nothing wrong with them. You've just cranked up the gain on your image. So if your image is a little ugly, make sure you check your frequency, because if you go brightening up everything, you've just made an ugly image brighter. So those are the main 4. There's a couple of other things with this system. The whiz button is labeled whiz here next to the button, has this little magic wand looking thing. If you push it, it lights up green, and it also tells you here that it's on. What that is an auto optimizing function. So as you scan from organ to organ, the system will make adjustments for you based on the information it's receiving. It tells you, it defaults to being off all the time with each preset. So if you want it, you're going to have to turn it on, and then it tells you here if it's on, and then when it's off, it tells you it's off. It gives a little more contrast to your image, so whatever was dark is going to show up a little darker, and anything that was bright is going to show up a little brighter. It's not perfect, so it's not like you can just hit that button and not mess with any of the other things that we talked about. But sometimes if you're struggling to get it exactly how you want, try using that. It might help, and it'll vary by what you're looking at and then the size of the animal. So, but a lot of times or mostly what it does is it changes your gray map, which is another thing that's listed up here under map. You have the option to change your gray map as well with this number 3. So if you push it, you get these choices. Basically what you're doing is kind of changing the shade of gray you're looking at on your image. The top ones are generally a little softer. If you want more contrast in your image, it's usually the lower ones. But when you hit the whiz button, it will change gray map, and it will also adjust your gain sometimes. So just one little extra thing you can use to optimize. And then the very last thing is your harmonics. Is it on right now? Yeah, this CHI up here stands for coded harmonics imaging. And the button to turn it off and on is right here to the left of your comment bar. It says CHI. What that does is it sends in kind of a broader range of frequencies, filters out some of the lower ones, and keeps the higher frequencies, and gives you really pretty near field resolution. Overall, it makes your entire image better. If you turn it off, you will notice a huge difference in the resolution of your image. The only reason you might want to turn that off, because it does default on all presets, it should come on. And again, it tells you right here if it's on. If you turn it off, that goes away. So you won't see CHI, plus your image will be a lot worse. But if you are scanning a large animal or an animal that the owner won't let you shave, you have to go through all this hair, then sometimes you need that extra power and penetration to go deeper. And taking harmonics off will allow you to do so. Okay, you guys have any questions on really the main 6 ways of optimizing? No? We encourage you to play with a bunch of buttons. There's some other options on here. On this other page is your dynamic range. What that is, what is it set at now? 63, it's pretty low. Usually that number's within the 70s. But what this number does is if you like a softer image, go up with that number. If you like, or whatever you're looking at, if you need more contrast, go down with the dynamic range. What that is it's the number of basically how many shades of gray are on your image. So the higher the number, the more shades of gray and a lot softer. The lower you go, the more black and white your image gets. But we encourage you to change things and try to fancy up your picture. And if you feel like you've just messed up and you can't get back to where you need to start, all you have to do is go back to your probe and choose your preset again, and it'll start all over. Okay, so once you have your image the way you want, for a still picture, you're going to hit freeze and then P1. P1 stores it to your hard drive on the system itself. And then did you still decide you're not sending images anywhere else?
Ideally, yes, but
Okay.
at this moment, no.
Okay. So every picture you take is just going to be stored on the system. Once you freeze, you have a timestamp here. It's in this lower right-hand corner. That's how many clips that has been recorded that you can track back with your trackball. In case you pass the adrenals and you didn't hit freeze in time, you can backtrack through them. If you've taken a lot of time between each picture, you have a ton of frames you can go back through. If you're going along taking really quick pictures, then you don't have a lot of cine loop to go back. But there are functions here. Once you start tracking back, you can run or stop the cine loop. You can do frame by frame with this number 4 arrow key here. That is a little bit more intricate movement. Like if you just need to go back little tiny frames that make up that picture, you can use these buttons instead. If you use your trackball, sometimes it scrolls back really quickly. Does that make sense? If you need just itty bitty little sections, I would use frame by frame. And then you can run a cine loop, and you can start it at a certain spot and you can end that loop, and then you can record that whole cine loop by hitting P1. But in general, for a still picture, just hit freeze and then hit P1. If you would rather have a video clip instead of a picture, don't hit the freeze button, just hit P1, and it's going to be a 3-second retrospective video. So whatever you just saw the last 3 seconds of, it will record it. And when it populates, I don't know if you can see that one does not have a film strip. If you want a video, you just hit P1 by itself, and it populates with this little film strip icon. That's how you know it's a video. And then if you had an animal that wasn't being very cooperative and you don't have a lot of time to scan them, you can just take a bunch of videos, and then you can use your cursor and you can go back up over here and double click into it. And I know you can't really tell, but it's playing that video, and then you can scroll back with your trackball or the frame by frame, and then you can take pictures off of that video and then go back and delete it if that's what you want to do. If you want to label your image after you've frozen, go to the comment button. The easiest way to do it is hit comment. It will bring up a library of choices. You can go up with your cursor and you can choose the word, and then you can just drag it wherever you want to, and then you can hit set to keep it there, and then you can go back up and grab another. If you have more than one word on the screen and you don't want to delete all of it, F10 is word delete on your keyboard. It's kind of hard to read because it has that protective cover, but you can hit F10 and it will delete the last word that you typed, or you can hold down clear and it takes away all of it. You can just randomly start typing if you want, and then move that. Actually, is it not letting me move it? Let me see if it lets you do that. Oh, there we go. Guess it just didn't want to do it at first, but if you start randomly typing and then you decide, well, I really wanted to say this, then it's going to add it to what you've typed. So just keep that in mind. All right, so that is labeling. And one thing about this library is that can be edited. If there's words on there you're not going to use, or there's words you need that aren't there, just let me know and we can add those. if you want to measure, you just go to the measure key above the trackball. It'll bring up a cursor where you can do just a generic measurement if you want with your set key. But if you go up and you choose what you're going to measure, then you don't have to label that image because it's going to label it for you. So say you were going to do adrenal width. If you do that, it's going to put the label here for you, and then it will store it all into the report at the end of your exam. It'll have all of your measurements on one spot, and then you can P1 this picture, and that way they're all there with your images. You don't have to do that. You can just do generic measurements if you'd rather, but the option is there. Any questions about labeling or measuring? No? Another thing about labeling, there's a body pattern button. If you push that, it's basically going to give you the choice for some diagrams of how the animal was laying. You can come up here with your cursor and you can choose a different one. It basically just gives you a little reference point, and you can move your cursor around and show where your probe was placed, and then you can set it there, and this little icon will show up on your image. If you ever accidentally hit that button, all you have to do is hold down the clear to get rid of it. And then you also have an arrow key on the keypad. If it's F2, if you ever wanted to point to something on your image, you have the option of changing the width and the length of that arrow with these two arrow keys right here. And then just hold down clear to get rid of that. All right, so around the trackball, you've got set, which is your enter key, body pattern, measure, clear, and cursor. And again, if you don't see a cursor and you're trying to figure out where it's at, just hit your cursor button. The options around those, B mode is your basic black and white. Just to get back to this scanning screen is your B button. The one next to that is CF, which stands for color flow. So if you push it, it's going to bring up a box. The way that you will optimize color flow is, first of all, you want to keep this window small because your frame rate will go down tremendously if it's too big. Your set key and your trackball change the size of that box. And that also works for the size of your sector too. If you're ever scanning and you need to narrow your scan plane to get better resolution, like say you're measuring the gallbladder wall or something, you can change the sector size the same way with your set key and your trackball. And then just hit set again to keep it that size. And then to optimize color flow, now number 5 is scale. If you put that color box up there on top of an artery and you don't see anything, go down with your scale and then up your color gain, which is going to be the same gain, the same gain for black and white. And then also you can look at your frequency. You might have to drop your frequency to get better color flow as well. But those are going to be the 3 main ways to optimize color flow. And this CF button is directional. It's going to tell you that red is coming towards the probe. Don't pay attention to what it looks like now, but if it were an artery. And then blue is going to be going the other way. If you want to check out blood flow of like kidney or a tumor, really teeny tiny blood flow, tiny vessels, then you can use your power Doppler. And your power Doppler on this system is configured to be one of these U keys. So these keys can be configured to be different things, but that's most of the time power Doppler's up here. So power Doppler is going to give you color flow that's not directional. It's really good for very low velocity flow. It's very, very sensitive though. So if you have an animal that's moving around a lot, this one doesn't look too great. But it is not going to tell you if the flow is going one way or the other. So if you're looking for like portal flow in the liver and you need to know if it's going the right direction, this would not be ideal. But it's just really sensitive, really good for low flow. And you'll optimize PDI the same way you would color flow with your scale, your gain, and your frequency. And again, it's configured to be U1 on this system. I think it's going to be U2 on your other system, but not sure why that powered down. Power it back up. The next U button is harmonics on this system. I'm probably going to configure yours to be active images. Does this outlet work? Do you guys know?
It should.
I have it plugged in and it's telling me that your battery's critically low.
Sometimes it's loose in the back of the machine.
Have y'all had an issue with that?
I mean, usually I just,
That's stapled in.
but it's not plugged. Usually it's loose in the back of the machine if I have.
Oh, you know what? This may have not been that good. I'm not sure, but let's try that. Because Steven's going to come re-image this and I don't want it to be dead. Okay, let's see if that works. Okay, so let me get out of Power Doppler. Active images, I will configure this key to be that function for you guys. And what that does is when you go into U2, it's basically just going to take you into a screen where it shows you all the images you've taken in a bigger form than just these little icons. So you can pick and choose. You can delete things that you didn't really want to take a picture of. U3 is called Scan Assist. Are you guys familiar with that one? Scan Assistant, if you go into it, it should, on your system, take you directly into a protocol. This one's got some choices on here, so let's just go. I'm going to start one of them, but again, yours should take you right into it. No, I don't want that one. It should take you into a complete protocol. I bet it's this one. So what this does is it's going to label the image for you. It's going to walk you through a complete abdominal protocol. If you're wanting everyone to kind of follow the same thing or you don't want to miss a step, it's a good way to do a comprehensive study. So if you wanted to start with liver sagittal mid, if you take that picture, it's going to automatically toggle to your next image, and it labels it for you. So the only problem with that is if you came across like a tumor or something you needed additional images of, what you can do is take your cursor, come over here to the pause icon underneath, and then you can clear out your labels, and then you can take all the images that you want, and then you can go back and unpause the protocol to start it back. Okay, and you can also, there's a little pencil icon here on the left. If you want to create your own protocol, you can do that. It takes you into Designer. It's a little tedious, but if you wanted to make your own, you can do that for sure. To get out of Scan Assist, you have to hit the button again. So you'd hit U3 to take you out, or there's a little stop sign underneath it, but it's quicker to do it this way. The next button down has its own button. It's called Scan Coach. Similar to Scan Assist in the way that it labels, but you are going to have three. You're going to have a cysto, a fast scan, and a complete abdomen for dog and cat. So this is a really good teaching tool, but it's also good for showing like the client what's going on with their animal's organs. So when you go into it, it's going to give you animal positioning, some scan planes, but also if you go into this little REF icon here with your cursor, it will give you a reference image of what you're looking for. So this will be the reference image, then your live image is side by side, but keep in mind that say you found your perfect picture and you took a picture, that shows up with it if you haven't gotten out of it. So if you're sending off for telemedicine or you don't want someone to know that you were looking at the reference image for some reason, then all you have to do is go to this little backspace. But also I do believe that whenever you take a picture, I think it boots you out of the reference every time, or a lot of systems do. I'm not sure about this one, but you just have to go back into it because it assumes you're not going to use the reference every single time you take a picture. I think that's why it boots you out. But if you want it back, just go to REF, and then say you weren't really sure what the cat pancreas looks like, you can just scroll down, find it, and then you can go to your reference image and it'll bring it up. Okay. If you need to show a client what's going on with their animal's kidneys, you could pull up normal versus theirs. So different reasons to use it, but it's a very good teaching tool. And again, just like Scan Assist, you have to hit Scan Coach to get out of this, or you go down to it would be more time consuming, but you could backspace out and then go to the stop sign. But if you do it this way, it's going to ask you, are you sure you want to exit? And then you have to say yes. And you can go back in and change the protocol and pick something else if you want to. So those are pretty much the two things that you have to hit the button to get out of it. You can't just hit B. So I didn't touch on do you guys do, are you doing any echoes? Any heart scanning? Yeah, okay. So all of your cardiac and vascular functions are pretty much above the trackball. You've got color flow, pulsed wave if you want to measure the velocity of a blood vessel. Then you hit PW. It's going to bring up a cursor. Place that cursor within the vessel, and then you can use your set key to toggle back and forth between your spectral and your Doppler. And then to get out of that, you can hit B. M mode if you're doing any fetal heart checks or cardiac. You can do measurements using M mode. You drop that cursor within whatever it is that's moving, and then it's going to populate down here with the M mode tracing. And again, you can hit B to get out of that. Dual and quad, basically what they sound like. If you go into dual, you can compare two images side by side, and you toggle back and forth between the active image and the frozen one just by hitting dual. If you do quad, they do get pretty small. I don't really recommend using these because on your images they'll be tiny. If you are in a color flow image and you want to compare a live shot of color flow with black and white, you can hit dual and quad at the same time, and then you have two live images with and without color flow. And then again, you can hit B to get out of that. When you go to end your exam, you're going to go to the end exam key down here. And this is the same thing that active images is. So just so you know, that U button I was telling you, this is what active images looks like. So you could come up here, say you really didn't want that picture. You can go over here to delete, and it's going to say, are you sure? Yes, I am. That way you can kind of clean it up before you end it. When you guys are finished and you're completely content with your study, you don't have to do anything except go down here to end current patient, and then it's going to end it and store it to your hard drive. If you wanted, I'm going to go ahead and delete this. You can highlight the word or the patient, and then you can go to delete. That way I'll take it off his system. If it's in the same 24-hour period, you can highlight it and you can go to, actually I can't resume any of those because they're over 24 hours. So you can highlight an old study and do new exam, and then it will populate their data. But if I hadn't deleted that other one, you can highlight it and then resume will have an option down there because it's in the same 24 hours. You can just add to the study if you want to. But other than that, that's all you have to do is go to your end exam, and it's all stored on your hard drive. Does that all make sense? You guys have any questions about any of these thousands of buttons? Just in a nutshell, you just go to patient, start your study. I know you guys do a lot of fast scans, so you don't necessarily have to put the patient information in there, but if you were to, and it will let you store pictures, it'll fuss at you and tell you that you don't have a patient put in, but when you go to end the study, say you were doing a cysto or a fast scan and you came across something you wanted to take pictures of, just go back in at some point before you end it and go put patient data in. Because it's not going to let you store it if you don't have it tagged to a number in it. Not necessarily a name, just a number is all you really need. But you can start scanning first and then go back in and do this if you want to. I think that's all the buttons. You guys have questions? No? There is, I know your system probably didn't come with it. Because it was a demo system, but there is a quick guide I can email you guys and you can print it out and have it with your system if that helps. I still don't know why it's telling me that your battery is low. I'm beginning to wonder about your outlet there. Do you guys have animals to practice on that you know of?
I'm not sure if she has.
I thought Dean definitely weren't gonna be here.
I don't know if they planned on scanning today or if that was for tomorrow.
Yeah, because they can only scan it once a week.
Yeah, asked,
Oh, they have people coming in to teach you guys?
Yeah.
Oh, got it. Okay.
yeah.
What do you want to mess with the buttons? And I'm sure you'll have questions if you start playing with things. Feel free to do so if you
I
want
think
to.
the quick guide is gonna be the best.
Yeah.
It really is. It's kind of a short.
Yeah.
It's like, and with the demos, it's hard to tell if they actually sent it or.
Right.
What I would do though, honestly, is I'll email it to you, and then I would just have it printed out like at a nice place where it's nice and colored, and it's basically a short version of what I went over. It's going to show you how to label, how to measure, how to store a study. There's a lot of information I think in there about sending to a PACS, which I don't know if you guys are doing, but it's very simple to set that up over the phone too, if you decide to. So when you would end your study, if you were just storing somewhere else, it would store it here as well, but it would automatically ship it over to wherever, whatever. Do you guys send your x-rays anywhere?
Antech.
Oh, okay. Then it would do that too. Or you can just use Antech for like telemedicine, and it would store it here, and you could choose to send it somewhere else. What you would do is, so you go to the patient screen, say we wanted to send this somewhere. You would double click onto it because then it takes you into the exam view, and this is all the exams that one patient has. So then you would highlight it, and then if we had Antech's information into here, you could highlight it and then hit send to, and it pops up a window saying send it from local to AIS or wherever. It's very simple to do. So I'm not sure how you guys are going to do it if you're using Antech for storage as well, but either way it's very simple, so you don't have to decide that today. But to revisit an exam you've done, all you do is go to your patient button. All of the exams that you've done will be right here. All the patients that you have done will be right here. And then if you double click into it, it takes you into the exam view. And that's where all of your archived studies will be, is under patient. There is a little hard drive here. If you hover over this on the patient page, it'll tell you how much disk capacity you have left. So once that starts to get over 50% full, you kind of want to start thinking about what you want to do with your studies, because it can make your system run slower the more space is filled up on that hard drive. So if you guys choose to send them somewhere else for storage, then you can just delete them off here if you want to. But if you're not comfortable with that, you can get like a 2 terabyte external hard drive and plug it into one of these USB ports over there, and you can save them all to that if you want to. But if you want to delete a study, you can just highlight it and go to the delete tab down here. And you can do that in bulk. You can search by like date, or do a bunch of them and delete them at once. But just keep an eye on that, because I have had a doctor that let his hard drive get completely full, and then this button won't work. It won't let you hit P1 anymore. So, and I guess it doesn't like warn you. It'll warn you about the battery, obviously, but it doesn't warn you that your hard drive's full, that I know of. Any questions? No? Alright, well, do you think of some? Let me know. I'm going to figure out why your battery is not charging now. It's this one.
Chelsea's not here, so I call into a Gidget, but that ain't gonna last long.
I've got Wi-Fi and Dixon's here. Dixon's easy to
It's
scan.
mostly just if anybody wants to learn the buttons, because it makes more sense for them to train us on their scanning protocol tomorrow.
Yeah.
And I'll have to, like she said, I think the cheat sheet will
I was
help
saying,
the most.
It will.
Yeah.
We're not awake yet.
No.
But if there's anything you want me to go back over, 'cause since this is basically just knobology for you guys, we can,
And she recorded it, so.
I saw
Okay.
that, yes.
yeah. But just remember, when people get confused, it's because the functions of these keys change. So if you, especially if you accidentally get to a different page, then you don't have your frequency, you don't have focal point, you don't have any of the things that you were looking for on this screen. So just make sure you look over here. Right now I'm on page 2 of 3. So if you go down to 3, and there's options on here, like if you want to change the tint map, which is instead of shades of gray on here, it kind of gives it a tint, and I'll show you. You can scroll through them and you can kind of tell here. Let me crank up the gain and that might help. There we go. There's some wild colors on here, but some of them come in handy, especially when doing cardiac. Sometimes it's nicer to not stare at the same shade of gray all the time to see things. So you can change it to like the bluer tint map, which is kind of nice. I don't know that you'd ever use these crazy ones, but it is nice. You can change the spectral Doppler, like if you're measuring velocities of blood vessels or doing cardiac. Sometimes it's nice to change your spectral Doppler color because you can see where to measure a little better. But tint map is here. And then, so you have frequency, cross beam. That's another thing that you probably won't mess with much, but it's set to low. What that does is basically creates your image from different steering angles with the beam. Gray maps, we talked about focus number and focal position. So yeah, just keep in mind that this has pages. If you accidentally hit these arrows instead of your number 5, it'll get a little confusing. And then you guys do, once you get really familiar with the buttons, if you decide that when you go to, say you go to small abdomen and you don't like the fact that it starts at a depth of 6 centimeters and you're constantly having to change it, whenever you're in it, you can go back to the preset and there's a button here called overwrite. You could change the depth to what you want and then hit overwrite, and that would permanently change it until you change it back. So there's things you can do, like if you find yourself changing something all the time, you might as well change it to what you want. But just remember, it's kind of a permanent thing until you permanently change it back. But otherwise, as you're scanning, making all these adjustments, as soon as you go to probe and choose the preset again, it starts it all back over where it started. definitely an option for you guys to change. And then the icons down here, I don't think I mentioned these. There's active images is actually over here as well. I think, or is that your worksheet? Oh, doesn't let you go into that. Oh, I think it's because I don't have. Let's see. Okay, yeah. So this little icon is active images as well, but sometimes it's kind of a pain to have to get your cursor and go over to it. So I will make sure your U button is that. There's a trash can, so you can delete images as you go. If you accidentally hit the P1 button, you can highlight it here and then go down here to the trash can. Save as. If you guys probably don't get people wanting images sent home with them, do you? Clients? Not so much here. Okay, you can probably ignore that one. This save as icon is if you did have someone that wanted images like on a USB, you can plug a USB in and you can hit that icon. But you can also do that. We can configure your P2 button, which is this next button above P1. We can, since no one has a printer anymore, you can, in fact, I'll do that on your system as soon as it starts behaving. I'll change that one to USB. That way you have the option if you want to store locally or save it to a USB. I don't think you probably will use it, but there's no sense in having it be a printer. Just give you more options. Okay, well, if y'all want to play around with the systems, I'm going to see if this, is there anything we can plug in, like that powers up that I can test this outlet?
I don't know, but that battery pack's green and they're both plugged into the same outlet.
Yeah, something's clearly, let me see.
Or just switch it.
It could just be the
That's
plug
what I
on the outlet.
Right.
Because I know they will get more.
We're just doing it.
Yeah. Green.
I didn't know about this part.
It's all good.
Yeah, so this game is green. I just don't know why.
Yeah.
I know you're wrong.
Oh, it's so scary.
Yeah.
It's not picking me up till 4, so.
Okay, it's green either way.
Because it was supposed to be 12 to 4. Right.
I was like, Chelsea's at some brain Opti and Declan. Chelsea's
works
supposed to
fine
be
on
bringing
that.
Opti and Declan, and then apparently there's a patient we can use if we want to.
Hope it's not a moose.
It's not moose.
I mean, he would just lay there, probably.
He
It's a
would.
Boston.
But him got lots of crap going on.